This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org.
Okay, welcome everybody. So glad you're here. I am so excited to be here. My name is Jason Brand. I am a therapist in Berkeley, California, and this is my first time doing this, so just really a cool experience. I'm a senior deliberate practice instructor at Sentio, and I'm going to talk a little bit more about my role in a second, but on behalf of Sentio University and their MFT program and the APA, the American Psychological Association, welcome everybody to the Deliberate Practice for Psychodynamic Therapy. We are on the fourth one of these, and very, very excited to have our esteemed guest expert, Hannah Levinson, here. So I can't say enough good things about Hannah, who I know from, because I'm in the Sentio Supervision Residency Program, which we're going to talk a little bit about, but Hannah sits in and is a full-on active member of that as well. And so I've gotten the great pleasure to learn along with Hannah about deliberate practice and to learn from her about deliberate practice and all these various areas in which she's an expert. So welcome, Hannah.
Thank you so much, Jason. Pleasure to be here.
And a little bit about you, Hannah. Hannah is a professor at the Wright Institute here in Berkeley, California. She has specialized in brief dynamic psychotherapy for 40 years, so 4 decades worth. She has offered over 85 professional papers. She has 7 books, 3 of which are newly released deliberate practice books. She has a video series with the APA illustrating her approach. And based on my interactions with her, as I said, she's also an expert in deliberate practice. So again, welcome, Hannah. How are you today?
I'm very excited to be here, Jason, and to be doing this with you. Thank you.
Yeah, cool. Okay. Well, let's see. Let's talk a little bit about Sentio. There's a lot going on at Sentio, and I'm going to run through it quickly because we're going to get to why you're all here today, which is to engage in some actual deliberate practice. But as you can see, Sentio has a marriage and family therapy program that they recently opened. They're accepting applications for that. They also have a counseling center, a low-fee counseling center, where I can't say enough good things about the training that the trainees get there. MFT trainees, really, really good training center. And in addition to that, there is a supervision residency program, which I'm a part of, which is a 1-year deep dive into learning deliberate practice as a supervisor. And you get 2 trainees or 3 trainees to work with, and you're in a weekly supervision meeting. And I can't say enough good things about what a great program that is. So check that out. I'm actually going to put in the chat here links to all this good stuff while Hannah is talking about something very exciting, which is, let's back up, which is the Deliberate Practice Summit, which is coming up in October. So, because you're going to be one of the featured guests there, Hannah. So can you talk a little bit about that experience, what's coming up?
Yeah, this is a first time. Thanks. The Deliberate Practice Summit is a first time event. It's being held in October, as you can see, in the LA area. I'm very excited to be a special guest along with Tony Ruminier and Alex Vash, who do an extraordinary job of making the deliberate practice come alive. I'm just going to let that person in. And
I got that, Hannah.
Thanks. And I invite you all to come. Tony wanted me to let you know that there's $300 off for the next few days. So he wanted to make sure I said that. They're going to cover the waterfront in terms of deliberate practice, in terms of supervision, what it's like to do for training, how you can become more expert in your field using it. There'll be researchers there, supervisors, people who are involved in deliberate practice at many different levels. I'm really looking forward to it. And my role will be to parachute in and talk a bit about deliberate practice in 3 areas: psychodynamic, accelerated dynamic, experiential psychotherapy, and emotionally focused therapy for couples. So I'm looking forward to that and hope to see some of you there in October. Thank you.
Great. Yeah. And I mean, it's exciting for us because we get to meet each other in person. And because deliberate practice is sort of, a lot of it happens across the world, as you can see by the people that are here. So it's really nice that we're going to have an opportunity to actually meet each other and hang out in person. So that is going to be a great opportunity. So if you have attended one of these before, you've probably seen this slide, which is just a little bit of conceptual learning here, because we're about to get into more procedural learning. But in deliberate practice, we like to make the distinction between conceptual learning or knowledge and procedural learning or knowledge. And conceptual kind of learning is the kind of learning that you do in reflection. So it might be writing a paper, or it might be meeting with your supervisor to talk about a case, or it might just be, reading on your own. And conceptual learning is great, and really to be a skilled therapist, you really do need kind of a base of conceptual learning. What we're going to be doing today, and one of the real missions of deliberate practice is to kind of balance the scales, which is to add more procedural learning to the therapist training learning process. And procedural learning is learning by doing. And so you can see the picture of the person playing the piano there. So it's one thing to read all about playing the piano. It's another thing to actually play over time and get the skills that you need. And hopefully, that if you're practicing, and what we're going to demonstrate and you're going to take a part in today is a kind of practice that really prepares you for the real thing. Because we like to think of psychotherapy as there's a performance element to it. And again, the best therapists, and you talk about this in the book, Hannah, have a well-balanced knowledge between procedural and conceptual. And we're about to get into some procedural learning in just a minute. Anything to add there, Hannah?
No, let's move it along.
Let's move it along. Okay. So Sentio, in addition to all this other stuff they do, they have Alexander Voss, who is the director of training, and Tony Rubenaire, who is the president and executive director. They've co-edited and authored about 12, 13 books about deliberate practice now. And you can see here today, we're actually going to be getting into this one, which has the wonderful picture, kind of the most complex, which we've talked a little bit about in other webinars. So today we're going to be getting into the psychodynamic psychotherapy book, and it's cool. What each one of these, and I'll flip a slide here. Each one of these has 12-ish, sometimes there's 14 exercises in the books. And you can see that they kind of break down different skills that you can learn within a particular kind of therapy. So this is the 12 skills that are in the psychodynamic therapy book, which Hannah and her co-writers, Jeff Binder and Volney Gay, wrote together. And you can see the 12. Today we're working our way through these. We're up to number 4, which is making process comments. And I just want to say, having spent some real time with this book now, first of all, it's a very creative book. It's much more than just a manual. I don't want people thinking, oh, this is just kind of a psychodynamic therapy manual. There's a lot more. It's deeply creative. And I guess, Hannah, that's the first question I want to ask you. How did you pack all this in? What was it like to get this down to 12 exercises in a field of study as big as psychodynamic therapy? Can you talk a little bit about that?
Yeah, it's the kind of thing I should have my head examined before getting trying to do something as enormous as this. But myself and my two co-authors really had a challenging but marvelous time trying to take a field that's been in existence for more than 100 years, and how do we break it into 12 skills? Now, I don't want to say that these 12 skills say the entirety of dynamic psychotherapy. Far from it. We focused on those skills that we thought beginning trainees would be having particular difficulties in doing, right? We did a survey of supervisors and teachers and asked them, what kinds of skills do you think would be helpful in allowing, your students to learn in an effective and an efficient way some of these types of interventions. We also looked at the research literature to see what are the common factors that get mentioned over and over again that kind of delineate a contemporary psychodynamic approach. And so these 12 seem to capture so much of when we talk about unconscious processes or corrective emotional experiences or the importance of development, the relationship, and so forth. So today we're going to be focusing on making process comments.
Great. And can you just say a little bit, Hannah, just because I'm curious about the creativity? It seems like it was very important that this be a creative endeavor for you. Can you talk just a little bit about the kind of the creativity in this book?
Sure. Thank you.
Yeah.
Some of the other books are rather straightforward with here's a skill and here's how you apply it. Here's a skill, here's how you apply it. But psychodynamic therapy, as you know, is much more complex, and it's not a one-size-fits-all. And so we created various mock patients that would exemplify certain styles, certain enduring maladaptive patterns, certain traits. And then as the book goes on, the person participating in learning the skill gets to know these patients and what their dynamics are, and then how to apply these skills for that specific patient. Not generically, not for all patients, but what might work for this patient sitting in front of me in particular. So that's where I think some of the creativity came in. How could we make this more similar to what a trainee or even an experienced therapist might encounter in the reality of clinical practice?
Yeah. And one thing that's cool about the book for me is how layered it is. So hopefully we'll get a little chance to talk about some of the people that make up the patients of this book, the clients. And but they're also based on work that you had done earlier, the video series that you did for APA. So there's just it's very nice the way this is layered. So you could actually if you really wanted to do a deep dive in this, you could actually see what some of these actual interactions look like through the APA series. So I just thought that was a smart, fun way to kind of link all this together. So really cool. Let's get into it. Anything else you want to say, Hannah, before we kind of get into making process comments, the fourth of our webinars?
Well, as Alex and Tony are fond of saying, gravity sometimes takes us away from doing the deliberate practice. We get so comfortable talking about our concepts and so forth. So I think we should dive in.
Great. And a plug for May 16th, pointing out defenses and inquiring about underlying fear. So we're going to be stepping through each one of these, and also a plug for the first three, which you can find on YouTube on Sentio's website. Okay. All right. Well, let's get into it. Making process comments. So what we're going to do here. So this is a little bit of just kind of getting our feet settled so that we know kind of what we're doing. With a book, you'd have two trainees and an instructor or a supervisor, and you'd be doing this for our purposes today, because that would just be too cumbersome. What we're going to do is we're going to read the way that the criteria works, give you an example, and then in the chat, when I flip to the next slide, you're going to have an opportunity to actually put in the chat what, follow this criteria, and then Hannah and I will look at it and give you some feedback on kind of this deliberate practice of making process comments. So skill criteria.
Maybe before you get into the criteria, say a word about making process comments. Would that be okay?
That would be great. Please do, Hannah. Can you give a little background on what is a process comment? Why would we want to make process comments? Yes, please. Thank you.
Right. So we put this in the book, and I love this skill. It is a workhorse. Now, you do have to have a bit of courage to use process comments. But once you get over that hump, it just unfolds so much. So we distinguish, of course, between content and process. And so many of the trainees, when they're working with patients, want to hear the content. They want to hear the stories. They want to hear, well, what happened? And what did you say? And that's all fine and good. But the real way, if you're doing a relational type of psychodynamic psychotherapy, what really makes the process unfold and where you can get a lot of mileage with regard to outcome is by focusing on the here and now in the here and now. And process comments get known by different terms. Perhaps you know them as a immediacy or meta-communication, but it's really focusing on something happened right here between us. What was that? And what were the feelings involved? And what are the consequences of that? And so by focusing on that, you can get a good sense of what are the enduring maladaptive patterns. You can help elucidate unspoken emotions that are going on. And it certainly leads to self-awareness and even insight. So like I say, this is a workhorse skill. So that's my
brief. And one follow-up question, Hannah, which is, why might it be challenging to make a process comment for somebody who has not done that before? Why would that be hard or challenging?
Well, the patient is talking about their story, they're commenting on things, they have a whole list of verbiage that they're getting into, and it means that you as a therapist need to interrupt that process, right? And kind of introduce doing something different. Okay, we've been talking about things, and now we're actually going to take a look at what's going on in the room. Sometimes I use the metaphor of, lyrics versus the melody. We've been talking lyrics, which is all well and good. Stories are fascinating for sure. But now we're going to get into the melody. What is the theme that keeps occurring? So it does mean shifting. It does mean interrupting. And it does mean taking the patient in a different direction.
Great. And that leads us right into the criteria for doing it, for making a process comment, which is that you have to do this thing, which is interrupt and ask permission to look at what happened right now between the therapist and the patient. So, and number 2 in the criteria is name what just transpired between the therapist and the patient. So we're going to see an example of this in just a minute. And then there's, for the third criteria, there's a couple options here. The first is to invite the patient to explore their feelings about what transpired. What do you think that was about? Why did that happen between us? Or that the therapist conjectures about the patient's feelings about what transpired. I think maybe this is going on. Okay, great. So let's look at an example. The context of this is that Dr. Ingram, the patient, has been talking excitedly about his new book project. And as he does, the therapist glances at the clock behind Dr. Ingram. And the patient sees the therapist look over the clock and says, well, now I forgot. What was I saying? How odd. And the therapist, following the criteria, says, can we look at what just happened? You were speaking about your new book project, and when I looked at the clock, you forgot what you were saying. Criteria 2. I'm wondering what looking at the clock meant for you. So that's using the first option. The second option, do you think that when I looked at the clock, it was because, did you think that when I looked at the clock, it was because I wasn't interested in what you were saying? And that's taking this conjecture and turning it into a question for the patient, Dr. Ingram here, to reflect upon. Okay, so that's what this is going to look like. Now, in the next one, we're going to show you the context and what the patient says, and we're not going to show the therapist response, and we're going to ask all of you to please put into the chat what exactly, what you might say following this criteria. Anything to add there, Hannah?
Yeah, no, that sounds good.
Okay, let's do it. All right, everybody ready? Get your fingers warmed up, and here we go. Okay, so the therapist asked the patient, Mr. Johnson, a challenging question about what he was feeling when he was talking about something upsetting. And Mr. Johnson says in a monotone, are you going to be here next week? So following this criteria here for the skill making process comments, please throw some stuff in the chat.
And we'll give you some time to do this.
Yes. Great, we got our first one here. And I'm going to read it out loud here, Hannah, to you. So Mr. Johnson says, are you going to be here next week? And the therapist says, I'd like to pause for a minute. I noticed that I asked a question that may be difficult, and then I noticed you asked about our meeting next week. I wonder, what just happened for you now? What just happened now?
Yeah, so my job is to kind of make comments about what you're putting forth. First of all, I love the way you started. I'd like to pause for a minute because you're really making this kind of your own. You don't always have to say, can I interrupt you for a moment? Do you mind if we take a look at what just transpired, right? So you're saying, I'd like to pause for a minute. And then you pointed out, I asked a question that may be difficult, and I noticed you asked about our meeting next week. So you made it clear what transpired, right? And then you're wondering what happened, right? So that's option number 1. You're inviting the patient to explore what just transpired. So I think you've got it. That sounds terrific.
Yeah, I agree. I think that really nailed it. Okay, so let's go to this one, Hannah, by Dyer, who says, can we take a look at what just happened right here between us? When I asked you about what you were feeling, you asked about next week. I'm wondering if you were feeling a bit uncomfortable about my question. So that's the option 2. What's your sense of that one, Hannah?
Right, so there we have criterion 1 done, criterion 2, same thing. And now the option number 3, option 2, conjecture about what the patient might be feeling. I'm wondering if you were feeling a bit uncomfortable about my question. So that sounds right on to me as well. Yeah,
and can we take a look at what just happened right here between us? I think that's nice. It kind of grounds that it kind of clarifies that there's a process going on between therapist and patient that is happening in real time. So like you said, the melody or the other part of the music that all of a sudden it kind of puts us right there. Let's focus on that for a second. I like that way of saying it. Here's from Toby. I noticed that when I asked you that hard question, you changed the subject to ask about our next appointment. I wonder if you don't really want to explore my question.
Right, right. So here I'd say, make sure you get in criterion 1, right?
Okay.
That you ask permission to interrupt. It helps the patient. Now, obviously, if you were writing these criteria, you might write them differently. This is not, in cement. But here we were trying to get the trainee to kind of say, we're doing something different here, and asking permission is kind of a foot in the door to make that switch. And then you point out what happened. I asked something and you changed the topic, right? And then I wonder if you don't really want to explore my question, right? Now, that is maybe putting it a little bit more in what I would say verging on an interpretation.
Mm.
But I could also see that it would fit under a conjecture, right? So it's that kind of mushy line between sometimes these conjectures actually can lead to interpretations, right? So I think that one is on that fence. But certainly it would get the person to think about what is going on here in the relationship.
Yeah. And I think we should flip to the next slide, but I have a question about, so this is a conjecture. What's the difference? Because this last one, it sounded a little bit to me like a confrontation also, of, it seems like you want to get away from this. What's the difference between confronting the defense maybe, which we're going to get into next time in the next webinar, and conjecture? Can you talk a little bit about that?
Well, the literature actually speaks about sometimes these conjectures do seem like confrontations. They do seem like so there's not a fixed boundary there. That's why I'm saying it's more permeable. And sometimes if you say a conjecture in a certain way, as this one is, where it's not a question, but really a statement, right? Then it can start verging into something that might feel like a confrontation to the patient.
Okay, great. Great. I think we should move along. I'm sorry we're not going to get to all of them, but please, keep writing here. I'm so glad that everybody's just getting a chance to kind of practice this. And that's really what the spirit of today is just getting a chance to practice. No right or wrong answers, just and I think what's nice about this is what I notice in my own work is that when I practice and have these criteria in my mind, all of a sudden it just kind of pops up for me in session with my patients. So, just writing in the chat, just trying it, please. It's great. Keep going. Okay. So, let's see. Oh, real quick. So here's what the book has. Can we take a look at what just happened? Criteria 1. I noticed that after I asked you about your feelings, you asked me if I'm going to be here next week. Criteria 2. I'm wondering what is going on for you just then. Very close to what a bunch of people had, which is great. Okay.
And
Let's move on. Yeah, go ahead, Hannah.
That in the book, sometimes if trainees get stuck and they don't come up with something, improvise something, they can look in the back of the book and see, oh, here's what therapists would see. Not that it's the right answer, but a possible answer, and that can help then kind of get their juices flowing.
Yeah, I find that very useful, and totally agree that within the books there's just tons of examples of how to actually kind of what you can say. I find that very useful. Okay, let's move on. Again, we have Mr. Johnson here, and the context of in the session is that the therapist has just announced to Mr. Johnson that it would soon be time to end. And dejectedly, he says, I've been feeling kind of hopeless lately. So following our criteria here, making a process comment, what would you say as a response to Mr. Johnson? Tim, quick on the draw again. Let's see what you got here. Okay, so a response would be, I know our time is almost up. I would like to take a minute to check in about your last comment. Can you tell me what happened for you when I mentioned we are ending soon?
That sounds great. I like the way it got framed with the time almost up. And then I'd like to do a check-in about the last comment. The only thing I think to really meet criterion 2 would be to explicate what transpired between the therapist and the patient, right? You said X, I said Y, you said Z. So to make that interaction clear. And again, in actual therapy, doing it in this precise way is not at all necessary, and in fact would be counterindicated. But in learning, we do have the trainees go through these steps. And if a quote mistake gets made, if something gets left out, then simply the person who's role playing the patient says, let's try that again. I think you need to say more for criterion 2. And the person role playing the therapist just does it over again. So that these quote failures are not how we usually think about failures in traditional supervision, but really as our opportunities to get back in and practice some more.
Yeah, and what I like about the way you just broke that down, Hannah, is so you focused in on the second criteria. So we might go in, and this is what we do in deliberate practice within the supervision, is that you have a skill and that there are criteria along the path to completing the entire skill, but we might pause on number 2, or for a lot of people, asking permission to take a look at what happened in the here and now is hard. And so we might focus there and just kind of keep doing that with a context and a patient example, just to get used to it, so that when we're under the pressure of an actual session, we go, oh yeah, I know something about how hard this is, and I've practiced it. I've got that in my procedural memory, as we talked about. So that's why I really like the way these things are broken down like that. So let's go for another example here. Victoria says, can we look at what just happened? I noticed that when I told you our time was almost up, you seemed to have a shift. Was there something about ending the session that affected you?
Yeah, that is just fabulous. And maybe something I can point out here, now that we've seen a half a dozen or so of these, is the differences, in how people say things. So you're all following the criteria, right? But you're making it your own. And that is something that we find with the trainees. For any one exercise, there are actually 15 opportunities to get the skill criteria, right? So there are 15 of these contexts and prompts. And then what we find is by the time we get to the end, the trainees are making it their own. They're using their own voice. Now, rather than it being kind of clunky at the beginning, now we see that it's smooth and that there is vocal intonation, and that's always rewarding for them to see.
Yeah. And so this isn't about turning people into deliberate practice therapy robots.
Right. And again, sometimes I quote Miles Davis, the famous jazz musician, who said at some point in his career, it takes a long time to sound like yourself.
Yeah. Yeah. And in that last one, Victoria, you seem to have a shift. For some reason that sounded very much like somebody's voice, like there's something very personal about that little bit there. And so I think that's what's nice as we practice this, we get to kind of get to know our own voices and what feels right on us and what doesn't feel right on us. And so it's a real opportunity to do that. We're getting lots of good ones here. Let's go one more. Lillian, who we didn't get to last time, so I want to go for Lillian here. Can we take a pause here? When I said our session is about to end, you commented that you have been feeling hopeless lately. Can you tell me more what prompted this comment? I'm wondering if you don't want the session to end.
Right. So there we have that kind of combination veering into, we've got a conjecture, right, about the patient's feelings that might be veering into, an interpretation. But I love this. It seems to flow very well.
Yeah. What I love about it is the use of the patient's language. I mean, just that she was clearly listening to the patient, and she says, she references hopeless. And I think that just makes people feel seen and heard when, especially when asking about something hard, like, what's going on between us in this room. It's very nice. Great. Okay, let's take a look here at, just real quick, can we take a look at just what just happened? A bunch of people got that. When I said we would need to end the session, you voiced a feeling of hopelessness. Was there something about my saying it was almost time to end that caused some disturbing feelings? That's good. It really kind of just gets to, like, we taught, kind of names maybe disturbing feelings. That's great. Okay, let's move along to the next one. Okay, Mr. Johnson again. Here's the context. My family tells me that I need to help myself. The therapist responds, well, you're coming to therapy. And Mr. Johnson says, wow, I'm feeling pretty weak. Okay, this one strikes me as a little bit harder. I'm very curious what people will put here. Are they organized by difficulty level, Hannah?
Right. Yes, they do get more difficult as they go on, because we know that the trainees have been successfully completing them. And if they need to go back and do it again, so by the time they proceed, they have success.
Got it. Okay. So my family tells me that I need to help myself. Therapist says you're coming to therapy. Client says, wow, I'm feeling pretty weak. Curious what people come up with here. Okay, Sky.
Maybe we can give a little more time, because sometimes it's
Sure.
hard to fight when
Sure.
we're talking over it.
Got it. Okay. Let's go with Sky's here. So would it be okay if we looked at what just happened here? What happened inside of you when I said, whoa, they're coming in? Would it be okay if we looked at what happened right here? What happened inside of you when I said, you are coming here? I noticed you sighed. What feelings might have been under that sigh?
Okay, so we've got a lot in there. First of all, again, I'd put in that criterion to name what transpired, okay? So that, when I said something positive, supported, you said something about your coming to therapy, you responded with feeling weak. So to tie those two together, patients often need that reminder about what are you seeing and what were you hearing. And then we have, you can point out the sigh, right? And what feelings might have been under that sigh. That's so creative, right? So you're taking now a nonverbal, and you're saying, we can look at that. There are feelings under that. And so I could see this being very helpful for allowing Mr. Johnson to get into some of his feelings. Lovely job.
Yeah, it's so nice. And you can imagine a patient feeling very held by that kind of somebody actually noticed my nonverbal cues. And so that's great. Okay, let's look at another one here. Can we stay for a few moments on what just happened? When I noticed that you are helping yourself by coming to therapy, you sighed deeply and shared a feeling of being weak. What was happening inside of you right then? What feeling brought up that deep sigh?
Yeah, lovely, lovely. I mean, you're really getting the hang of it. I can see the flow. You know, we talk about fluidity in the responses, and these are wonderful examples.
Yeah, great. And I like this one. I think this is a good place for us to transition to the next. Natasha says, can we pause here for a second? I noticed when I pointed out that you've been coming to therapy, you sighed and said you felt weak. What was it like for me to point out your strength?
Right. Lovely. Lovely.
Yeah, and just a really nice conjecture, because in order to do that, though, it's kind of challenging. The therapist has to know what they're doing, right? I mean, you have to know that you've pointed out a strength.
Right, right. This does mean being very aware not only of what's going on with the patient, but also what's coming out of your mouth, right?
Yeah, and that's what we're practicing. All right, let's take a look at this response here. Can we pause for a minute and look at just what just transpired? I stated that you were doing something to help yourself by coming to therapy, and you responded about feeling weak. I'm wondering how you were feeling about my saying something positive about you. Nice. It's almost like you got uncomfortable with my saying something positive about you. Great. Okay. Moving right along here. We got another one here, and we have Anne, another patient who's written. So we've covered all three that are in the book, examples of patients. So this is Anne, and she begins the session uncustomarily, talking very quickly to the point where it's hard to understand what she's saying. And the therapist, says,
You want to give them a chance to do it, or?
oh yeah, sorry, I got a little confused. Thank you, Hannah. So imagining yourself as the therapist here, your patient comes in uncustomarily talking very quickly. Can't even understand what she's saying, really. How are you going to respond using these criteria to make a process comment? Okay. Nice. I can see one coming in that's already looking good. Maybe give people one more minute. Okay, I'm liking this one. I'm just going to go ahead and read it to you, Hannah.
Sure.
Anne, I'd like to pause for a moment here. I notice that you've been talking really fast since the start of our session, which is not like you. Can you tell me what's going on?
Right. That checks all the boxes. Just beautifully, beautifully done. Right.
Yeah, I like the use of the first name to create this pause. I think that was really nice. First time we've seen that. Okay, we got another one here by Victoria. Could we slow down a bit and pause? I notice you're speaking very quickly today, and I'm wondering what's going on with you right now.
Again, excellent. Just, 1, 2, 3.
Yeah.
Very, very beautiful.
This kind of demonstrates the workhorse idea that, you're nodding, you're saying yes. What do you hear in there in my comment?
Well, just that you can accomplish so much in this kind of in the moment, here and now, stopping the action, right? You can get someone to sink into what they're feeling, feelings that they might not even be aware of, right? So you're getting her, first of all, to slow down, talking very quickly, letting her know that it's uncharacteristic. So there's something going on. It's implicit and even explicit in what's being said. And then maybe Anne can sink into what's going on for her. And maybe, as we'll see next time, when we look at defense, is there something defensively going on?
Nice. Yeah. Okay, let's take a look. Sorry to interrupt, but could we take a look at what's occurring right now? You came into session, sat down, and started speaking pretty quickly. So quickly that I'm having some trouble following what you're saying. Can you tell me why you're talking so quickly today? Right. So it really mirrors what Victoria and Lillian put in. Great. Okay. This is I
have a suggestion here.
Yeah.
Jason, see what you think.
Sure.
People are so getting the idea, right?
Yeah.
And very eloquent about it at this point. I'm wondering if we could take some questions that maybe in the chat, people could put any questions at all that Jason or myself might be able to answer. We often don't leave time for this kind of thing, but I think all of you are getting this so well. I'd like to give you the opportunity.
I think that's great. Let's go for it. I'm going to stop the share and see if we got some questions about process comments, about just kind of psychodynamic psychotherapy in general, things that you're noticing
Especially about deliberate practice.
Especially about deliberate practice, yes. Things that you're noticing, what's challenging about what you found in doing the exercises. Love to hear your questions.
Or maybe some comments.
Yeah. So Natasha says, any tips for making process comments with adolescents? This is a question close to my heart. I'm noticing that a lot of my deepening experience process comments fall flat. Wonderful question. Thank you, Natasha. You want to take a first crack at this, Hannah?
Oh, I'm going to hand that to you because adolescence is your bailiwick.
Yeah. I mean, honestly, you got to tread carefully. I think, in the beginning, I mean, this is just me, because I work with a lot of adolescents and a lot of kind of skittish adolescent males who don't necessarily, want to be in therapy. So a lot of it for me is therapeutic alliance. I was actually working with a guy the other day, and I want somebody who just came in. And one thing that I'll do, as opposed to making it about the young person sitting in front of you, so I'm noticing that one thing that I'll do to kind of create a little bit more distance in terms of a process comment is make it about therapy in general. Sometimes, let me stop for a moment here because you're hitting on something. I'll try to hit all the criteria. I'm not sure if I'm going to. Sometimes in therapy, people get a lot out of thinking in this particular way that you are thinking right now. So as opposed to making it so personal, you and I'm pointing out, this is something that happens in therapy for young people sometimes. And I'm also giving a thumbs up that like we're doing therapy good right now in a less direct way, because I want to encourage a therapeutic dialogue between me and this adolescent. Anything to add there?
Sounded good.
Okay, Sky, thank you for your comment. It's fun to hear colleagues' ideas or responses. Yeah, I hope everybody's having some fun. Deliberate practice is supposed to be fun. I mean, it's supposed to really be on that edge of pushing and really just spontaneity, trying things out. That's what we're going for. Thank you.
And with Mayer's comment, you know, getting at a kind of the other side of the coin, there's a vulnerability in doing deliberate practice. Could you talk about how you handle this vulnerability? Yeah, you know, there is a vulnerability in that you're practicing, but I'll tell you a couple of guardrails there. Number one, as Jason was just alluding to, it's fun. You try and create an atmosphere where there's there's no big stakes here vibe. There's no real patient here. No harm's going to be done. And the whole idea with deliberate practice is it's called failure facing, which means that failures, you leave out a criterion, you get a criterion wrong, what have you. These are ways we all learn. This is how we know when we're right at the cusp of our learning edge. And so the whole process gets reframed. It's now not saying just the right thing to impress your supervisor. It's like, how can I try this out? Give it a go. And then if I miss that ball, I'll get another chance, right? So it creates that kind of more relaxed, fun aspect. So I hope that helps, you know, with the vulnerability part of it.
Yeah, and I think, you know, one thing that we've talked a lot about in our supervision group is we're really trying to stay out of shame. And I think that, you know, if we have any indication that there's shameful feelings coming up about performance, then we slow down, you know, or we change that. That's what's nice about having the criteria, is that you go to the first criteria and just work on that. So we're really trying to create an environment, excuse me, where we're tailored to the person and where they're getting stuck, but not too stuck. Let's see. Do you ever ask for responses and giving criteria guidance or building up the criteria level? I think we spoke to that. I just spoke to that, which is that we try to build it at the level at which the person is. Do you have anything more to add there, Hannah?
Maybe just to say that also with deliberate practice, we're looking for the zone of proximal development, which meant where is the trainee in terms of anxiety level? And after every 5 of these repetitions, after every 5 of these different contexts and what the patient says, we actually do a formal check-in and say, you know, on a scale from 1 to 10, how difficult are these exercises for you? Right? And we get feedback and we take it very seriously. If they say, oh, they're pretty easy, well, we just move along. If they say, oh, I'm kind of struggling a bit, okay, that's great. We're right in that zone of someone's learning something new. But if they say, I'm sweating bullets, this is really hard, you know, my hands are sweating, we back up. And as Jason said, we take it in smaller chunks.
Yeah.
So really making the training very specific, very responsive to where the anxiety level of the trainee is.
Yeah. And let's get to this last question before we have to stop, because it's such a good one. And I'd like to kind of put it in DP terms. How do you use process comments to address a client being late without evoking shame in the client? We all know this one. And what would we practice there in deliberate practice around, you know, the client coming in, and if we were worried about shaming them, how might we practice this? Do you have ideas about that, Hannah?
Well, I'm going to say an overarching thing, and then I think we need to shift gears because of the time, unfortunately.
Sure.
So rich. The overarching thing is when you start using process comments, when you start working with the relationship in therapy, then the patient gets used to these kinds of comments. It's not, oh my goodness, what did I do wrong? Now he's commenting on my behavior. That gets done kind of in an ongoing way. And similarly, patients can turn the tables and ask about, hey, when I talked about such and such, I saw you look at your watch, or I saw an expression on your face that looked like disgust, or, so in other words, the reality of the relationship takes front and center stage in a way that isn't about shame, but about doing the work and having a better outcome.
Yeah, great. And we might just practice the first criteria here of that might be a way to help with the shame, or to help with the worry, is just to help somebody practice kind of getting in there, slowing down, asking those questions. So, going step by step, I think helps with this as well. I'm aware of time, and I could just keep going. I'm so glad that we got a chance to do this. I'm so excited to be here. May 16th, we're going to be doing it again. We're going to be applying all that we learned and talked about today to defenses, pointing out defenses. And Hannah's going to be back. Please come join us again. Come with your questions. I like this question and answer thing that we did. Hannah, anything you want to add before we have to stop for today?
Just thanks for showing up. See you later.
Yeah, bye guys.
This webinar is made possible by the Sentio Marriage and Family Therapy Program. Visit us at www.sentio.org.